On the tombstone of my working career, I want founding Cape Fear Health Net to be on it. I'm Scott Wisnett. I'm retired from a career of 24 years at New Hanover Regional Medical Center. In my role as Community Engagement Director at New Hanover Regional, I noticed that the clinics and the resources for the people who didn't have health insurance were scattered, not coordinated, and very frustrating for those who tried to access it. So we looked for a way to make that better for them. So the community in Wilmington that was serving the uninsured was very fragmented and very siloed. In fact, all the nonprofits were siloed. Around that time, say 2005, we applied for a grant at Kate B. Reynolds in Winston-Salem, and the process was you had to drive to Winston-Salem and personally make your pitch for the grant. And so I think the low moment in this particular area came when I went on that given day, I think it was 2005, and we made a pitch, I think it was for pediatric dentistry. And the director said, do you people in Wilmington ever talk to one another? Because this is the third person that's driven to Winston-Salem today and asked me about pediatric dentistry. So I was a little humbled by that and a little chastened. And around that same time, one of the grant officers of the Duke Endowment told me about an idea in Columbia, South Carolina, where the whole community had come together as one entity to serve the uninsured. So I made a field trip there, and it was kind of like nirvana of uninsured health care. All the uninsured people could go to one place, or actually any place, and be qualified for health care in all places. This grant officer said, there's no reason you can't do this in Wilmington. You've got everything you need. You've got free clinics, you've got a hospital, you've got hospital-based clinics, you've got a teen clinic, you've got resources most communities don't have. You should be able to do this.
My name is Andre Leonard. I'm the medical director for Cape Fear Health Net. So the way I got involved with Cape Fear Health Net was I was approached by Dr. Jan Run. She was the medical director at that point in time. She served both as medical director for Cape Fear Health Net and for Cape Fear Clinic. And she was moving out to Arizona, and she approached me to see if I'd be interested in helping out and helping recruit physicians to participate. I wasn't sure at that point what that meant. I wasn't even sure what Cape Fear Health Net was, but I had known Dr. Ryan for several years when I worked with her in the hospital. I had a great deal of respect, and it's hard to refuse her. She's so nice and been such a pillar of the community. So I said sure, and so that's when I became involved and began to learn the ropes of Cape Fear Health Net. As the medical director, my role is to help recruit and maintain our referral base for specialties. So patients who may either be uninsured or underinsured, we try to help provide access to specialty care. So the primary care offices will send referrals to our office, and we will help arrange for these specialty referrals.
I'm Sheila Roberts, Executive Director of New Hope Clinic, and have served as the board chair for Cape Fear Health Net. So I joined New Hope Clinic as Executive Director in 2009. And immediately we were connected with Cape Fear Health Net to ensure our patients were getting access to additional services than what were available at our organization.
A lot of people who don't have the finances, they don't have insurance, they don't have Medicaid, they use the emergency room as their primary care physician, and that's never good.
When I was a hospitalist, I did that from 1998 to 2005, I took care of patients just in the hospital. Well, there was a patient, this was around 2000, that I saw who came in with a mass on her shoulder. It was probably almost 12 inches, large. The patient, the reason I was seeing him is not because the mass had typically is a surgical or dermatologic issue. I was seeing them because they were so anemic. This patient had a basal cell skin carcinoma. That patient should have never been to the emergency room, should have never gone to the hospital. She should have seen a dermatologist years earlier and had what should have been a tiny little skin cancer removed. That's what we're trying to prevent. I don't want to see a patient like that come with a problem that should have been addressed many years earlier.
My name is Leslie Smiley, and I'm the Executive Director of Cape Fear Health Net. Cape Fear Health Net provides access to health care for individuals who have low income and are uninsured. They don't qualify for government programs, they aren't offered insurance through their employer, or they can't meet the criteria for subsidies through the open market. So we get those folks connected to a primary care provider where they can get all of their medical needs met, their prescriptions that they need daily for chronic diseases or any other needs they might have. And without that, they wouldn't have access to health care.
My name's Todd Fowler. When I came to this clinic, I was a mess. I was a mess in life, mentally and physically. Cape Fear Health Net helped me when there was nothing else out there to help anybody. I was at a bad time in my life, having a lot of medical issues. I was brought over to Cape Fear Net, Dr. Ryan, Dr. Jennifer. I would not be here talking to you now if it was not for Cape Fear Health Net, Cape Fear Clinic, the doctors, the pharmacists, the nurses, people to answer the phones, make your appointments for you. They're all 100%, and I'll tell you again, I would not be alive today if it was not for the Cape Fear Clinic.
My name is Melissa Bastianta. I work for Cape Fear Health Net. My favorite part of my job is helping people. That's how I got here. It's what I love to do. I just enjoy seeing them get what they need. They come in here not having anything and are really struggling with not having medical, not having ever seen a doctor, and then we get them to a primary care doctor, and then from there they may need to see a physical therapist, or they may need to see a cardiologist, or they may need to have medication, and we can provide all of that for them. And then once they come back and be like, hey, thank you so much. You know, we never could have ever dreamed to have these services, and I've gotten them all, and it's all because of your services, and it's all because of Cape Fear Health Net.
Cape Fear Health Net is a wonderful program. In the 14 years I have been here, I've seen it evolve into what the community needs. Whatever the community needs are, we're here to help with the uninsured. The uninsured patients that come through here are patients that would not have any other choices or resources to be seen for their medical conditions. And because of Cape Fear Health Net, patients' lives have been changed. Patients are now living healthy lives. This Cape Fear Health Net does a wonderful job of helping the uninsured. And this I feel, it's not even the job anymore. It's just what I do and what I enjoy doing.
I'm thankful for the opportunity for the past 15 years to be able to serve a community, and I look forward to continuing to do so.
I've had the privilege of working with Cape Fear Health Net since 2009, and I look forward to how much more we can do together to serve our community.
I want to say thank you to Cape Fear Health Net for all that it's done for our community and for the patients that it's served over the last 15 years. It's an honor to be a part of this organization, and I look forward to its continued success and growth as we move forward in the next phase.
Without health care, you have nothing. That's the most basic building block of our hierarchy of needs. And Cape Fear Health Net has been able to do that for so many people over these 15 years, and it's something that I always want to be associated with.